Welcome to the Getting Healthier Together module on taking your medicine. This video can help you understand ways to take medicines correctly, learn how to read a medicine label, find more ideas for taking medicine as prescribed, and create an action plan for yourself. Why is it so important to take medicine exactly as prescribed by your healthcare provider? It's simple. When you take medicines according to the instructions, there's a much better chance that your healthcare provider can tell if the medicines are working the way they're supposed to. Taking cholesterol and blood pressure medicines as directed may reduce problems such as heart disease, heart attacks, and stroke. There are lots of ways to make it easier to take medicine so it can do you the most good. Here are some tips. Ask your healthcare provider or pharmacist if you have questions about your medicines. Try to go to only one pharmacy for all your medicines. Try using a pill box to organize your medicines if you take more than one kind. Let your family or a friend know what medicines you're taking. Refill your medicine before it runs out. Keep a list of your medicines in your wallet or purse. What about if you think it's best to stop taking a medicine? What should you do in that case? Should you stop taking the medicine, then talk to your doctor at your next scheduled visit? Or should you stop taking the medicine and not mention it to your doctor in case he or she disagrees with your reasons for stopping? Or should you contact your healthcare provider and talk about why you want to stop taking the medicine before you make a change? Take a few moments to think about the best answer. Hopefully, your answer is the last one. The safest plan is that you don't stop taking a medicine without telling your healthcare provider. With some medicines, stopping abruptly can cause problems. Last but not least, contact your healthcare provider or pharmacist if you think you're having side effects. And definitely, if you think you're having a medical emergency, call your healthcare provider or call 911 immediately. Part of taking medicine properly is knowing how to read the labels on the containers they come in. In Part 2, we'll talk about how to make sense of the label information. Information on medicine labels can sometimes be a little confusing. There are 8 important parts of a prescription label: the name, address, and phone number of the pharmacy where the prescription was filled, so you know where to go or call when it's time for a refill, the prescription number, how and when to take your medicine, the name of the medicine, the number of refills left, your name, how much medicine there is in each pill, and the number of pills in the bottle. Let's take a few moments to see if this is clear. In this sample label, if Jane Doe has been taking this medicine as prescribed, what is the total number of days she can take the medicine before her doctor will have to write a new prescription or approve more refills? Feel free to pause the video if you'd like a little time to think about the answer. Is your answer 300 days? If so, you're right. There are 100 pills in the container. She's supposed to take 1 pill a day, and there are 2 refills. Since there are 100 pills in this container, when we add 200 more pills for the 2 refills, we get a total of 300 pills. At 1 pill per day, she has enough for a total of 300 days. Here's one more question, just for practice. What is the prescription number for this sample label? Is it BD123456789? 123456 or XYZ? If your answer is 123456, you're exactly right. Let's continue with what else might be on a medicine container. Some containers have special stickers. For example, a sticker might say, "Do not drink alcoholic beverages," or "may cause drowsiness," or "take with food." If the information on the sticker doesn't make sense to you, ask the pharmacist to explain it. As for the rest of the information on the container, especially if it's a new prescription for you, ask your healthcare provider or pharmacist these 6 questions. 1. What is the name of the medicine? 2. What is the medicine for? 3. How should I take it? 4. When should I take it? 5. What are the possible side effects? And 6. What do I do if I miss a dose? You could write each question on a separate index card and then ask your healthcare provider or pharmacist to write the answer in the empty space. Or you could use regular lined paper and leave room between each question to write the answers. If you write the answers yourself, it'd be a great idea to ask your healthcare provider or pharmacist to double-check that what you wrote is correct. In Part 3, we'll be talking about some tips for helping you take medicine as prescribed so it can do its job. There are all kinds of reasons that it can be hard to take medicine the way the prescription says to. We've come up with 6 of the most common reasons: forgetting, not understanding how or why to take it, simply not liking to take it, a fear of getting dependent on the medicine, fear of possible side effects, and believing it isn't needed. If you find that you're not taking medicine because you forget, there are lots of things that can help. You can use pill boxes and then make sure that the sections are empty at certain times of the day. You can write reminders on your calendar or use magnets or sticky notes that you put in places you're most likely to see. Another great idea is to link your medicine schedule with things you do every day anyway. For example, maybe you start a habit of taking medicine when you brush your teeth, or eat breakfast, or get ready for bedtime. If what's stopping you from taking medicine is that you really don't feel like you understand how to take it or why you should take it, the best idea is to talk with the healthcare provider who prescribed the medicine. He or she is the expert in treating the condition the medicine was prescribed for. If you don't feel that a medicine is important to you, ask your healthcare provider or pharmacist how it's supposed to help you. Maybe you just don't like taking medicines. Most people don't. But people take them because they know the medicine is helping their condition. Here again, if this applies to you, it's a good idea to ask your healthcare provider or pharmacist how the medicine will help you. Are you concerned that you might become addicted to a medicine? Most medicines don't cause dependency, but if this is a concern for you, don't hesitate to talk to your healthcare provider and get the facts. Are you worried that a medicine will cause unpleasant side effects? First of all, always contact your healthcare provider or pharmacist if you think you're having side effects. Your symptoms may or may not be from the medicine, but either way, your healthcare provider or pharmacist will help figure out if your symptoms are from the medicine. Your healthcare provider may adjust your medicine, change it, or ask you to stop taking it. Here's a question for you. What if your doctor prescribed a medicine to you because you were feeling bad and now you feel fine? There are still pills left in the container, and according to the prescription, you're supposed to take them until the container is empty. Is it okay to stop taking the medicine now? If your answer is no, you're right. Even if you don't feel sick, always keep taking the medicine as prescribed unless your healthcare provider tells you to stop. The more you know about the condition you're taking the medicine for, the more sense it'll make and why it's important to keep taking it. Remember to talk to your healthcare provider or pharmacist if you have any questions at all related to any medicines you've been prescribed. There's an Overcoming Barriers worksheet available to you if you want to see if you can match some of the reasons that people don't take medicines properly to some possible solutions after the video to review what we've covered. In Part 4, we'll explain how you can use a personalized action plan for medicine adherence. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for medication adherence handout that's available to you, and it looks like this. You'd begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the medication adherence action plan are organized into sections including take your medicines as prescribed and work with your healthcare provider. The other more general sections include be active each day, always check with your healthcare provider before starting any new exercise program, eat healthy, and no tobacco. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just one or two. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you're less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. The second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to use a pill box to organize your medicines, decide when you'll find or buy the box and when you'll set up your medicines in it. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called Medication Adherence, What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in getting healthier together.